punch biopsies are not always necessary. In fact, they're not what we want for pigmented lesions. I think this has always been a dogma that we have dealt with for so long. And unfortunately, it's just not going to lead to a good diagnosis. So punch biopsies are not the way to go for most pigmented lesions, or even just a lot of lesions, except for inflammatory skin disease. And even then, we should actually be looking at different methods, because sometimes the punch is still not right for that either. Okay, and then number 2 for me is going to be having clinicians understand what the timeline is for getting their path reports back, and that it's not a quick turnaround time for getting a decent, good diagnosis back. This is not a test that's a simple, lab test that the computer spits out the answer. It takes time, to actually produce a good diagnosis. The tissue has to be processed, and maybe testing has to be done. So the turnaround time is really non-negotiable, and so sometimes it takes a while. And I think that's something that, unless you have some knowledge of how the tissue is actually processed, which is, I go over that in one of my talks, you don't understand, what the process that the tissue goes through in order to get onto a slide under the microscope for us to look at and make that diagnosis. I think that's a really big myth, is that it's not a quick answer for Dermpath. And the third, sometimes the biopsy is not going to be helpful. So there's that myth that, the biopsy is going to tell you the answer. Unfortunately, especially when we're talking about inflammatory skin disease, it's not going to tell you the answer, the cause. It's going to give us a pattern, an inflammatory pattern, right? So it's not going to tell us what caused it. And so no amount of repeat biopsy or second opinion or stains or special stains is going to help us with that answer, right? Because that's just not what that biopsy is meant to tell us. We can't tell you what is causing your atopic dermatitis or allergic contact dermatitis. All we can tell you is that you have it. So I think that we have to understand what the limitations are of biopsy and what we actually are going to be getting as an answer, and what is not actually appropriate to be asking from the biopsy.